Welcome to our video on the threat of climate change to global public health. As temperatures rise and extreme weather events become more frequent, the effects of climate change extend far beyond the environment, directly impacting public health in profound ways. In this video, we will explore various critical issues, including the rise of respiratory ailments, the spread of vector-borne diseases, and the strain on healthcare systems. We'll also delve into how climate change threatens food and water security, exacerbates mental health issues, and drives displacement and migration. Join us as we uncover the hidden health crisis fueled by our changing climate. 1. Increased respiratory issues. Climate change is silently reshaping our world, and one of the most alarming consequences is the rise in respiratory issues. As the planet warms, air pollution levels soar, leading to an upsurge in respiratory diseases like asthma. Imagine trying to breathe through a straw. This is what many people experience as air quality degrades. Pollutants such as ozone and particulate matter become more concentrated in the atmosphere, directly affecting lung health. It's not just those with existing conditions who suffer. Even healthy individuals may find themselves wheezing and coughing. Children and the elderly are particularly vulnerable, as their respiratory systems are either still developing or already compromised. The situation is exacerbated in urban areas where pollution levels are naturally higher, making city dwellers more susceptible. Thus, climate change is turning the simple act of breathing into a daily challenge for many. 2. Vector-borne diseases spread. As temperatures rise, so too does the threat of vector-borne diseases, which are illnesses transmitted by organisms like mosquitoes and ticks. These pesky creatures thrive in warmer climates, and with climate change, their habitats are expanding. Think of these vectors as uninvited guests at a party. They don't just come and go. They spread diseases like malaria and dengue. In regions previously too cold for these vectors, people now face new health risks. The change in precipitation patterns provides more breeding grounds, further exacerbating the issue. This isn't just a problem for tropical regions anymore. Even temperate zones are seeing a rise in such diseases. The global health landscape is shifting, and the spread of vector-borne diseases is a significant concern. This change highlights the interconnectedness of our environment and our health, showing how climate change can have far-reaching implications. 3. Heat-related illnesses. The increasing frequency of extreme heat events is another dire consequence of climate change, leading to a surge in heat-related illnesses. Imagine walking through a desert without water. This is akin to what vulnerable populations endure during heat waves. The elderly and those with pre-existing health conditions are particularly at risk, as their bodies struggle to regulate temperature effectively. Heat stroke, dehydration, and heat exhaustion are becoming more common, placing an additional burden on healthcare systems. Urban areas, often referred to as heat islands, experience even higher temperatures due to concrete and asphalt absorbing and re-radiating heat. This urban heat effect can make life unbearable for those without access to air conditioning or adequate shelter. It's a scenario that plays out more frequently as global temperatures rise, making protecting vulnerable populations a pressing concern. 4. Food and water security threat. Climate change is not just about rising temperatures, it's also about the security of our food and water supplies. Imagine a world where a simple meal or a glass of clean water is hard to come by. That's the reality facing many communities as climate change disrupts agriculture and water resources. Crop yields are declining due to erratic weather patterns, leading to increased malnutrition. Water scarcity is becoming a norm, with many regions struggling to provide clean water for their populations. This scarcity results in a rise in waterborne diseases, as people are forced to use contaminated sources. The lack of reliable food and water supplies doesn't just affect physical health. It also impacts mental well-being, as communities grapple with the stress of an uncertain future. This threat to basic necessities underscores the profound impact of climate change on global public health. 5. Mental health impacts. The psychological toll of climate change is an often overlooked yet significant aspect of its impact on public health. Imagine living in constant fear of the next natural disaster. This is the reality for many communities. Anxiety, depression, and post-traumatic stress disorder are on the rise as people face the aftermath of environmental degradation and extreme weather events. The uncertainty of the future and the loss of homes and livelihoods contribute to a growing mental health crisis. It's not just the direct victims who suffer. Even those who witness these events from afar can experience eco-anxiety. This mental strain affects individuals' ability to function and cope, further complicating the challenges posed by climate change. Addressing mental health is crucial, as it is an integral part of the holistic approach needed to tackle the climate crisis. 6. Displacement and migration. Climate change is not just an environmental issue, it's a humanitarian crisis causing displacement and migration. Imagine being forced to leave your home with nothing but the clothes on your back. This is a reality for millions as rising sea levels and extreme weather events make certain areas uninhabitable. Displaced populations often end up in overcrowded refugee camps where disease outbreaks are common due to poor sanitation and limited healthcare. The stress of leaving home and the uncertainty of finding a new one add to the mental and physical health challenges. Migration due to climate change isn't just an issue for developing countries. It has global implications as nations grapple with the influx of climate refugees. The strain on resources and infrastructure in host countries highlights the need for international cooperation to address this growing crisis. 7. Strain on healthcare systems. As climate change intensifies, healthcare systems worldwide are feeling the pressure. Imagine a hospital overwhelmed with patients and not enough resources to care for them all. This is becoming a common scenario as climate-related health issues increase. From respiratory diseases to heat-related illnesses and vector-borne diseases, the demand for medical care is rising. This surge puts a strain on already stretched healthcare systems, leading to longer wait times and reduced access to care. Rural and underserved areas are particularly vulnerable, as they often lack the infrastructure to handle increasing patient loads. The burden of climate change on healthcare systems underscores the need for robust public health strategies and investments in healthcare infrastructure. It's a call to action for governments and organizations to prioritize health in climate policies, ensuring that systems are resilient enough to face future challenges.